Nature's Healing TV presents 7 early symptoms of prostatitis you should never ignore. Have you noticed that you are urinating more often than usual? Do you sometimes feel a burning sensation when you urinate? Do you wake up several times at night to use the bathroom? Or perhaps you have an unexplained pain around your lower abdomen, groin, penis, scrotum, or lower back. Many men ignore these symptoms. Some blame them on getting older. Others assume it is simply a urinary infection. And some men turn to traditional remedies without first discovering what is actually causing the problem. But there is one important condition that should not be overlooked: prostatitis. Prostatitis means inflammation of the prostate and, depending on the type, it may be associated with infection, pelvic pain, urinary problems, or other underlying factors. Today on Nature's Healing TV, we are going to examine 7 early symptoms of prostatitis that every man should know. We will also discuss traditional knowledge, including both classified and unclassified traditional practices, supportive foods and lifestyle measures, preparation methods, and most importantly when natural support is not enough. But first, remember this. This video is for education and general health awareness. It is not a diagnosis, and natural remedies should never be used as a substitute for medical evaluation, especially when symptoms are severe. Let's begin. Symptom number 1. Frequent urination. One of the earliest warning signs can be the need to urinate more frequently than normal. You may find yourself visiting the bathroom repeatedly during the day. You may also notice that you cannot comfortably hold your urine for as long as you used to. Some men may even wake up repeatedly during the night to urinate. This can happen because inflammation around the prostate and urinary tract can affect normal urinary function. However, frequent urination does not automatically mean prostatitis. Urinary tract infections, prostate enlargement, diabetes, bladder problems, and other conditions can also cause frequent urination. That is why persistent urinary changes deserve attention rather than assumptions. According to the National Institute of Diabetes and Digestive and Kidney Diseases, urinary frequency and urgency are recognized symptoms of several forms of prostatitis. Traditional knowledge. In many traditional health systems, frequent urination has historically been viewed as a signal that the urinary system needs attention. Traditional practitioners have commonly emphasized adequate hydration, moderation of bladder-irritating drinks, and the use of plant-based foods as part of general urinary support. But traditional knowledge should be classified into 2 categories. Classified traditional knowledge means practices that have been formally documented or studied, and classified traditional knowledge refers to practices passed down through families and communities without sufficient scientific testing. Both may be culturally valuable, but they should not automatically be considered proven treatments. Symptom number 2. Burning or pain when urinating. The second warning sign is burning, stinging, or pain during urination. Some men describe it as a hot or uncomfortable sensation when urine passes. Others may experience pain in the penis or urethra. This symptom is especially important because bacterial prostatitis can produce urinary pain, while urinary tract infections and sexually transmitted infections can produce similar symptoms. Do not automatically assume that drinking a particular herbal preparation will eliminate the problem. If bacteria are responsible, proper medical testing and treatment may be necessary. Acute bacterial prostatitis can sometimes develop suddenly and may be accompanied by fever, chills, body aches, and significant urinary symptoms. Traditional support. One simple traditional principle is to maintain adequate hydration. Unless a healthcare professional has advised you to restrict fluids, water supports normal urine production and helps prevent dehydration. Another traditional practice is reducing things that may irritate the bladder, such as excessive caffeine, alcohol, and very spicy foods. These measures may help some urinary symptoms, but they do not cure bacterial prostatitis. Symptom number 3. Difficulty starting your urine stream. Have you ever stood in front of the toilet and waited before urine finally started flowing? This may be called hesitancy. You may feel the urge to urinate, but starting the stream becomes difficult. Some men may also notice that the urine stream has become weaker than before. This is another symptom that should not simply be dismissed as normal aging. Problems with urine flow can occur with prostatitis, but they can also occur with benign prostate, enlargement, and other urinary conditions. The prostate surrounds part of the urethra. When inflammation or enlargement affects the urinary passage, urinary flow can become uncomfortable or difficult. This is why persistent changes in urinary flow deserve evaluation. Symptom number 4. Weak, interrupted, or dribbling urine stream. The fourth warning sign is a noticeable change in the strength or continuity of your urine stream. Instead of a steady flow, the urine may come out slowly. It may stop and start. You may also notice a few drops, continuing after you believe you have finished urinating. These symptoms can interfere with everyday life. Imagine constantly planning your journey around the location of the nearest bathroom. Imagine being afraid to travel because you do not know whether you will be able to urinate comfortably. These symptoms should not be ignored. The important point is that weak urine flow is not specific to prostatitis. Benign prostate enlargement and other urinary problems can cause similar symptoms. Therefore, the goal is not to diagnose yourself from a video. The goal is to recognize the warning sign and seek appropriate evaluation. Symptom number 5. Pain in the pelvis, groin, lower abdomen, or lower back. This is one of the most important symptoms. Prostatitis can be associated with pain or discomfort in different parts of the pelvic region. The discomfort may occur between the scrotum and anus. It may occur around the penis, scrotum, groin, lower abdomen, or lower back. Some men describe the pain as pressure. Others describe it as aching, burning, heaviness, or discomfort. Chronic prostatitis or chronic pelvic pain syndrome may cause pain that lasts for months and may come and go. This is where traditional knowledge becomes interesting. Traditional healing systems across different cultures have long emphasized warmth, relaxation, gentle movement, plant-based foods, and reduction of physical stress as supportive approaches to pelvic discomfort. One simple supportive practice recognized in modern medical care is a warm sitz bath. How to prepare a simple warm sitz bath. Fill a clean bathtub or basin with comfortably warm water. The water should be warm, not dangerously hot. Sit in the water for about 10 to 15 minutes. Afterward, gently dry yourself. The purpose is comfort and relaxation. A warm bath does not eradicate bacterial infection. It is a supportive measure that may help some men feel more comfortable. Medical sources also recognize warm baths and local heat therapy as possible. Supportive approaches for some chronic prostatitis symptoms. Symptom number 6. Pain during or after ejaculation. This is a symptom many men are uncomfortable discussing, but it is important. Pain during or after ejaculation can occur in chronic prostatitis or chronic pelvic pain syndrome. The pain may occur around the penis, pelvis, lower abdomen, or other nearby areas. Some men may ignore it because it happens only occasionally. Others may become anxious about sexual activity because they expect pain afterward. This can affect quality of life and emotional well-being. If ejaculation repeatedly causes pain, do not simply assume that it is normal. Discuss it with a qualified healthcare professional. Traditional knowledge sometimes associates male reproductive health with certain foods, seeds, herbs, and plant preparations. Examples commonly encountered in traditional diets include pumpkin seeds, vegetables, fruits, legumes, nuts, and other nutrient-rich foods. But here is the important distinction. A nutritious food can support general health without being a cure for prostatitis. Do not allow the phrase natural to make you believe that something is automatically safe or medically effective. Symptom number 7. Fever, chills, body aches, or sudden severe urinary symptoms. This is the symptom group you should take especially seriously. If urinary symptoms suddenly appear together with fever, chills, body aches, nausea, vomiting, or severe pelvic discomfort, do not rely on home remedies alone. Acute bacterial prostatitis can develop suddenly and can become serious. The NIDDK advises immediate medical attention for symptoms such as inability to urinate, painful and frequent or urgent urination accompanied by fever and chills, blood in the urine, or significant lower abdominal and urinary tract pain. If you cannot urinate at all, seek urgent medical care. Do not keep drinking herbal mixtures while waiting for the condition to disappear. Do not delay treatment because someone told you that a particular leaf can flush the prostate And never assume that every urinary problem is prostatitis. Now, let's talk about traditional knowledge. There are many traditional approaches to men's urinary and reproductive health. Some are classified because they have been documented, investigated, or incorporated into recognized complementary health practices. Others remain unclassified because their preparation, dosage, safety, and effectiveness have not been adequately studied. Traditional knowledge can provide valuable clues for research, but tradition alone is not enough to establish that a remedy can cure prostatitis. For example, certain plant extracts and supplements have been investigated for prostate-related symptoms, but evidence varies considerably depending on the substance, condition, preparation, and patient. Therefore, NHTV's position should be clear. Use traditional knowledge as supportive knowledge, not as a replacement for diagnosis and necessary treatment. Supportive foods for general prostate and urinary health. Instead of searching for a magical prostate cleansing drink, focus on an overall healthy eating pattern. Include plenty of vegetables. Eat a variety of fruits. Choose whole grains and legumes where appropriate. Include healthy sources of protein. Drink adequate water unless your healthcare provider has instructed you to restrict fluids, and reduce excessive intake of highly processed foods. For men experiencing urinary irritation, it may also be useful to observe whether caffeine, alcohol, very spicy foods, or other beverages make symptoms worse. Medical guidance for acute prostatitis may include reducing bladder irritants and maintaining adequate fluid intake. A simple traditional-style supportive drink. If you want a simple, food-based preparation, you do not need a complicated mixture of 10 different leaves. Try this instead. Wash fresh fruit thoroughly. Prepare it as part of a normal balanced meal or unsweetened fruit serving. Drink clean water alongside it. The goal is nutrition and hydration, not washing the prostate. And remember, there is currently no homemade juice that should be presented as a guaranteed cure for prostatitis. When should you see a doctor? You should seek medical evaluation if you develop persistent urinary symptoms, especially if you experience painful urination, frequent urination, urgency, weak urine flow, difficulty starting urination, pain in the pelvis, groin, penis, scrotum, or lower back, pain during or after ejaculation, blood in the urine, fever or chills, or difficulty emptying your bladder. A healthcare professional may use your medical history, physical examination, urine testing, and other tests when necessary to determine the cause. This matters because prostatitis symptoms can resemble other urinary and prostate conditions. One more important message for men: do not be embarrassed about urinary or sexual symptoms. The earlier you talk about them, the easier it may be to identify what is happening. Your body does not become healthier because you ignore warning signs. And seeking medical help does not mean that you have failed. It means you are taking responsibility for your health. If the cause is bacterial prostatitis, antibiotics may be necessary. If the problem is chronic prostatitis or chronic pelvic pain syndrome, management may involve a completely different approach. That is why identifying the type of prostatitis matters. Final summary. Let's quickly repeat the 7 early symptoms. Number 1. Frequent urination. Number 2. Burning or pain during urination. Number 3. Difficulty starting your urine stream. Number 4. Weak, interrupted, or dribbling urine flow. Number 5. Pain in the pelvis, groin, lower abdomen, or lower back. Number 6. Pain during or after ejaculation. Number 7. Fever, chills, body aches, or sudden severe urinary symptoms. Never ignore these warning signs. But also remember, having one of these symptoms does not automatically mean you have prostatitis. The symptoms can have several possible causes, and that is why proper evaluation is important. Nature provides many valuable foods and traditional practices that can support general health. But nature should not be used as an excuse to delay appropriate medical care. At Nature's Healing TV, our message is simple. Nature supports, knowledge guides, and responsible healthcare protects. If this information has helped you, share this video with a man, father, brother, husband, or friend who may need to hear it. Subscribe to Nature's Healing TV for more evidence-informed health education, traditional health knowledge, nutrition, and natural wellness tips. And remember, do not wait until a small warning becomes a big problem. Pay attention to your body. Your health is your responsibility. This video is for educational purposes only and does not diagnose, treat, or cure prostatitis or any other medical condition. Men with persistent or severe urinary, pelvic, or sexual symptoms should seek evaluation from a qualified healthcare professional.